I want to give you a brief introduction to the planes of the brain. Sometimes it just seems like, where are we in the brain? I don't know what direction is front or back or top or bottom, and they talk about rostral and caudal and superior and inferior, and I'm just totally confused. So let's demystify the terminology that we use as anatomists and as clinicians when we're talking about things in the brain or brainstem or spinal cord. So I have here a model of a brain. We're looking at the left hemisphere, and to your right is the occipital pole, and my hand is holding the frontal lobe. This diagram helps to give you the terminology that most of us use when we talk about the brain. Let's talk first about the anterior or rostral area of the brain. In this case, we're talking about the cerebral cortex, or the posterior or caudal region. That works for the brain, but when we're talking about the spinal cord, caudal or inferior is toward the sacrum, and superior or rostral is toward the cervical region. So it's more or less at right angles to the terminology we use for the hemispheres. And this introduces a bit of confusion, but let's see if you can follow me on this. We talk about the dorsal surface of the brain. That's the part near the vertex, near the superior surface. That's dorsal. And we talk about something down toward where the pituitary would be as ventral or inferior when we're talking about the hemispheres. However, when we talk about the brainstem or the spinal cord, we look at things toward the abdomen as ventral or anterior, as you use the terms in the spinal cord, and things toward the spinal processes of the vertebra as posterior or dorsal. So we have different terminology, same words, but different meanings for structures, whether we're looking at the brainstem and cord or we're looking at the cerebral hemispheres. Now, there are three planes that we cut the brain in. One is in this dimension here, which we call the coronal or frontal plane. We use the terms interchangeably. The other is in this plane, which is the horizontal or axial plane. And finally, if we cut it just between the two hemispheres, we have the sagittal plane. Let me show you these planes on wet specimens. So here we have a left hemisphere of a brain, has very nice bridging veins coming up to the dura here. You can see the lateral fissure and the cerebellum here and a bit of the tentorium. Also on the undersurface or ventral surface, we can see the great vessels here, the basilar artery, the carotid arteries, the cerebellum, and the brainstem. So we're looking now at the ventral or inferior surface of the brain. I turn it over and we are looking at the dorsal or superior surface of the brain with the dura and the superior sagittal sinus, even with some blood remaining in the sinus post-mortem. Remember the two laps of the dura. See how strong it is. I'm holding the brain by the dura, and the falx is in the midline. So superior surface or inferior surface, ventral, dorsal, more or less, when we're talking about the whole brain and the hemispheres. Here we have the brainstem, and this would be the anterior or ventral surface of the medulla, and this would be the dorsal or posterior surface. We look at the cerebellum. I can pull it down a little bit. This would be the superior surface of the cerebellum because it's toward the superior part of the brain, and this would be the inferior surface of the cerebellum. So now if I take a section and I use my knife and I cut in this direction here, this will be the coronal or frontal plane. such a plane would look like this. This would be superior surface. Here are the meninges. This is the inferior surface with the vessels on the base and the two temporal lobes, insular cortex, lateral fissure, and gyri and sulci, with the corpus callosum in the middle and the two lateral ventricles. This is a typical or classical coronal section with gray matter and white matter, deep nuclear structures, and the ventricular system. Now, if I cut in this plane, this is going to be the axial or horizontal plane, and this is rostral, this is caudal. The section will look like this. Here is anterior, posterior, occipital, rostral. Here is one temporal lobe. Here is the other temporal lobe. Here are our ventricles, the posterior horn or occipital horn, and the frontal or anterior horns of the ventricle, and the slit-like third ventricle in the middle. And again, you see the gyri and the sulci of the gray and white matter. You see the corpus callosum and the septum that separates the two halves of the ventricular system. Finally, here is a mid-sagittal section, which shows you the hemisphere. Here again is anterior, posterior, occipital, frontal, dorsal, ventral, lateral ventricle out to the side, large third ventricle. It's large because there's been a lot of atrophy in this brain. This is the brain of an older person where a lot of tissue has been lost. So the ventricles are very enlarged, making it easy to see the third ventricle here, the aqueduct, and the fourth ventricle. Remember, the ventricular system is our clue to where we are. If we see third ventricle, we know we're near the thalamus. If we see aqueduct, we know we are in midbrain. If we see this bulging pons and the fourth ventricle, we know that we are in the medulla and the pons with the fourth ventricle and the cerebellum above it. So a mid-sagittal plane is always nice. This one happens to have a nice example of a pineal gland on it.